Sudep is a very frightening condition. It stands for sudden unexpected death in epilepsy. And we recently got a guideline paper from our colleagues I think a couple of years ago, that suggested that there are certain risk factors that will give people a risk stratified kind of state, if you will. You're going to be either a low risk person or a medium risk person or a high risk person if you have this, this, and this. And one of the things they highlighted in that paper was how many generalized tonic-clonic seizures, or GTC seizures, people have. So that was a very frightening thing for us and for patients, because if you have more than a certain number per year, then you are simply a high risk patient. And if you don't, then you are simply a low risk patient, and so forth. And we wondered, is that kind of a static, frozen in time thing, or is that something that changes over time? Unfortunately, there's not a whole lot of longitudinal data on people with epilepsy, but we are very lucky that we are working with one of the largest seizure diary databases in the world, called SeizureTracker.com. And that gave us the opportunity to look at how does this risk change. So when a patient goes to the doctor's office and they say, I heard about this thing, Sudep, what's the deal, doctor? Then the doctor can actually give them a risk stratification based on the previous research. But we wanted to know, is that answer that they get something that is true forever, or is it just true for now? And that sort of set up our study. So if my patient has one or more than one generalized tonic-clonic seizures, then that suggests that if possible, we should do more. And there's many options for doing more. There are many FDA-approved medications and more coming to market. There are several devices that have the ability to reduce the number and quality of seizures as well. And there are some surgeries, and there are some special diet therapies. So the question that I and my colleagues would have to wrestle with if a patient came with one or more than one generalized tonic-clonic seizure is, have we done everything for you yet? And if the answer is no, then there's many other things that we should explore in trying to find out what is the right therapy that reduces the number of generalized tonic-clonic seizures and therefore reduces their risk of Sudep. There are reasons to basically back off from being aggressive at some point when you say, well, we've tried multiple drugs, you've had surgery, you're not a candidate for this, you cannot do that, and so on. And at some point, there are some patients, unfortunately, for whom doing more is just asking for side effects and not actually likely to reduce risk. But it's hard to know exactly when that line is. And when we know someone is at high risk, then I think that we would be more inclined as a community to try more things with patients.